Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm here in New South Wales in Australia, and today I'm joined by Maria Kunstadter, who's in Kansas City in the US, and that's right in the middle there, Maria.
Mm-hmm.
Maria, thanks for joining us on the podcast. Welcome.
Thanks
How
for
are
having
you?
me.
Oh, that's good. That's good. Always a pleasure. Now, Maria, you are the owner
Mm-hmm.
of the company, the TeleDentist.
Mm-hmm.
Can
Yep.
you tell us about the TeleDentist? What's the story behind the TeleDentist, and what inspired you to start this innovative platform?
Well, David, I tell everybody there are two things I love to talk about the most, my grandchildren and teledentistry, and I'll spare you the grandchildren today. So I will be glad to tell you about teledentistry, but the grandkids are really cute. But I am a dentist, and I have been a dentist for a long time. And it was back in 2012, 2013 that I was working with a group on the opioid crisis in Washington, D.C., and in these big conferences, over and over again as a dentist and the only one in the room, I kept hearing, the top 10 reasons people go to the emergency room, and toothaches were always in the top 10 reasons people went to the emergency room. And I'm like, that's crazy. Why would anybody go to an emergency room and wait hours and get no care and spend lots of money? And it just made no sense. And sitting at my, big conference table were physicians that were already doing telehealth, and I'm listening to them, and it just wave washed over me. And I thought, that's what we need. We need virtual dentists. I say to go all the wrong places people go with problems with dental problems. Pharmacies, hospital emergency rooms, walk-in clinics, everywhere but the dentist's office. And the TeleDentist concept was born in 2014. So when we started this, no one was doing teledentist consultations, video consultations. They were doing asynchronous, sending x-rays in and having the x-rays looked at and then sending them back, but nobody was doing consultative services with virtual dentists. So we had to develop our own platform, an app for our own platform, tested it, marketed it, research development, and worked on it for a while and talked to a lot of people, which was good because we decided in 2018 this was too big to go on our little boutique platform. So we decided to go with a large international telemedicine platform and get white labeled on that platform. And we did that in 2018. And then 2019, we went direct to consumer. And we're still pushing this new concept uphill, talking to everybody we could. And COVID hit in 2020, needless to say. So March 15th of 2020, COVID hit, offices started closing down, and insurance carriers started calling us and saying, we talked to you, would you see our patients? Would you be our teledentist? It's like, sure. And then, so we had a contract with a big payer in 3 weeks after March 15th. And then 3 weeks after that, we had a contract with another big payer to take care of their members who couldn't go to dental offices because of COVID. And then the last 3 quarters of 2020, because of COVID, our sales skyrocketed because people were either not able to get out, were afraid to get out, and lots of different reasons, but they still needed to talk to a dentist, find out what to do about their problem. And so we had we actually benefited from COVID because our company took off like, wildfire and became sort of a household word. People started understanding, oh, that's right, you could talk to somebody. We do e-prescriptions. We consult with them, tell them what kind of over-the-counter products they can get to help them. We work in now dental offices. Had we been, now if another pandemic hits, every dental office can be offering this service to their patients so that they don't have to abandon their patients or leave voice messages and not be able to talk to their patients. This is a tool that can be used to have access to your patients, and they can have access to the office and get help 24/7, 365 anytime they need a dentist.
Wow, that's a powerful story in terms of how one little idea, and just being in the right place at the right time to hear that idea working in medicine and saying,
Mhm.
why isn't this in dentistry? And
Mhm.
then being ahead of the curve when COVID hit and the demand was there because nobody could go to a dentist anyway, but they needed to find out what possibly was going on in
Right.
their mouth.
Right.
What are the challenges that you have in dealing with people virtually, as opposed to sticking your fingers in people's mouths and having a really good look around?
So we
Um,
we basically, I mean, if there's any dentists watching this, we basically do that first 15 minutes of any dental office. The patient fills out a brief medical history, a brief dental history, chief complaint on our app, and then talks, then that goes to a dentist. And then the patient sits down in an office or in front of their computer, and the dentist goes, tell me what's going on. And the dialogue you have between the patient, either virtually or in person, is really the cue to what needs to be done with this patient. So we then palliate the patient if it's a pain, broken tooth. Again, a lot of times the broken tooth is just rubbing the tongue. Lots of different problems that can be occurring. We can palliate the patient because you don't know what you don't know. Patients don't know there's a temporary filling material they can buy over the counter. They don't know that there's, warm saltwater rinses, cold ice pack, heat. They don't know what to do and they're terrified. So we palliate them. We can do e-prescriptions if a medication is indicated. We don't do narcotics, even though the Ryan White Act has allowed telemedicine to do narcotics. We chose not to do that. And then we educate the patients. This is the same thing that happens in an office. We say, here's the underlying cause. Here's what's going to happen if you don't get treated. Start taking this medication, do these steps. And if hands-on care is needed, we help them actually go into a dental office. We get an appointment for them in a dental office. Before COVID, we could do that within 24 hours. Now that COVID has hit and it's over and staffing's a challenge, we say we get them palliated and educated and triaged to a dental office within a week while they're starting to feel better every day. But patients are afraid of two things at the dentist: how much it's going to cost and how much it's going to hurt. And we help them take them off the how much it's going to hurt cliff by saying, you're going to start feeling better very quickly. This is what you need to have done. We educate them on what needs to be done. And then we send them to hands-on care if needed. For instance, our very, very, very first patient was a guy, during COVID, bored and nothing to do, was looking in his mouth, and basically he saw a tori and he thought it was a tumor. He's looking around, you spend too much time, and he got on, oh my God, I have a tumor. And the dentist could visualize it and see what it was and say, no, that's just a tori. Don't worry. Nothing needs to be done. And that alleviated his mental pain and his anxiety, and he felt better and knew and he did not need hands-on care. So and there are so many things that can be taken care of by having a consultation with somebody that understands the problem and has solutions for the problem. Again, it doesn't eliminate drilling. We don't drill on anybody. We don't extract teeth on anybody, but at 7 o'clock, 8 o'clock, 9 o'clock on a Friday, Saturday, Sunday, nobody else does either. And people still need to feel better and understand what's going on.
so when they call the teledentistry
Mm-hmm.
number, they actually get to speak to a dentist.
Correct. Our system is set up so that the first, telemedicine, teledentistry, the protocol is you have to be licensed in the state that the patient is in. So we have dentists licensed in all 50 states. And when a dentist says they are in the state of Missouri, for instance, there's a pest here. The dentists in Missouri get pinged as soon as that patient's name is entered into the app. And they may go out to 5 different dentists that are sitting on the bench waiting for calls. And that it's first come, first serve. The dentist that picks up the call. And our goal is to get someone seen within 10 minutes, but our wait time is less than 6. So the patient doesn't have to wait long. And if you're in pain or you have something urgent going on, you don't want to get an appointment 3 hours down the road. So we decided to make this a very on-call basis system that we use.
Right. How long are the shifts that your dentists do when they work as an on-call dentist?
It's up to them. We literally have more than one dentist in every licensed in every state, and we just sometimes they may not actually be on doing anything, but they'll have their cell phone. They can take a call with their cell phone, and we just ping them and say, "I have a patient in your state that needs to be seen," and they'll log in and take the call. So it's ad lib for the dentist and how much they want to be on call. And we have had the first month of COVID, we had 500 dentists join our system. So we've never had a lack of dentists that are participating, which is great.
Oh, wow. That's really good service. So you're almost like the Uber of dentistry.
We are.
You're the disruptor.
We are. Yes, we are quite.
Excellent. Wow. What an opportunity. And are these, I guess, these dentists who do the on-call, they then have to find a dental practice for the patient that's near where the patient is.
And that's correct? Our job. The dentists don't do that. They'll notify the person in the office that says this person needs an appointment with the dentist for this, underlying this problem. So that, the staff does that. So the dentist basically just consults with the patients. Again, we're very good at, consulting with the patient. Patients are understanding what kind of care they need are just better patients to refer. And then our staff will help them find an office to go to be taken care of. And that's a big deal for everybody. And in fact, its statistics show that, a person who's had a teledental consultation has lower no-show rates in offices. So our lead generation is a really successful program because they've talked to a dentist, they know what they want, they know what they need, and it actually has reduced the no-show rate because of teledentistry. So it expands the capacity of any existing dental office and allows for integration of dental services. It's a great opportunity for offices to, I like to say, add a chair to their office. Basically we have a whole system of how to integrate virtual care into your office and provide virtual care for your own patients. Let your community you're using, providing virtual care, and you'll get a lot of people, especially with the younger generation, that don't want to go into an office to find out what's going on. They want to be able to sit in their bed or at their desk and talk to a dentist. So it actually can really increase productivity in an office by not increasing chair time.
So let me get this right. The patient rings the teledentistry number. They have a paid appointment to talk to a registered dentist. Does that dentist that dentist can be somebody who just does teledentistry but doesn't then follow through as the treating dentist.
Correct.
And you can obviously have treating practices that don't do the teledentistry, but they're available to have the callers triaged to them once they've been diagnosed or worked out. Wow, what a great service! Tell me,
I love to say we don't compete with dentists. We actually expand their access to patients and put qualified, educated patients into their chair that know what they want and need, have been pre-medicated if there's an infection so they can start to work right away. And it takes that, whole chair time of an unproductive visit away from the office. That, I'm a dentist, patients would come in, sit down, and I'd say, you need to have this done. I don't have time on my schedule to do this, so let's set you up for 2 weeks down the road. It totally eliminates that appointment. We take care of that step for them. So we're making offices more productive, more accessible to their own patients, and more accessible to the community.
So you've read my mind here, because my question was going to be, how many of these people who call the teledentistry hotline aren't really in pain or an emergency? They're actually just after information at a time that suits them, in a manner that suits them better, more convenient than jumping in the car, driving down, sitting in a room full of screaming kids, and then getting
Exactly.
called into
Yeah.
a big chair that is uncomfortable for them.
Yeah, exactly. I mean, what I tell everybody is if we as providers, and COVID crushed the industry, offices haven't come back fully from COVID. Most industry standard is in the US, they're about at 83% productivity over before COVID. And because COVID crushed the way we do things, staffing's hard, so basically we have the capacity of moving the industry into a new realm, just like the Sarek machine did. You change the way you think by using technology to improve patient care, to improve access to patients and bring more patients in and be more productive. So we eliminate unnecessary office visits. I say there's about 25% of the visits, and anybody that's listening that's a dentist, go back to your office and as the week goes on, go, that person didn't need to come into the office. That person didn't need to come in. We eliminate about 25% of that busy work that doesn't need to be there, that they could put productive patient visits into those chairs, and we can expand their revenues and expand their access by having better quality appointments and a lot less no-shows.
Yeah, because you're right. Sometimes the new patient, it's a mystery visit for the dentist.
Right. It doesn't have to be anymore. Right. Mm-hmm. Mm-hmm.
Yeah, and of course that they need something big, and we've only allowed 15 minutes, or
Right.
they need something small, and we've allowed an hour, and then
Exactly.
we end up with a frustration in our relationship
Mm-hmm.
straight away from that mismatch or the miscommunication.
Mm-hmm.
Whereas the teledentistry process will help to triage into the right clinical time when they then go to the practice that gets chosen for them, or that gets
Exactly.
recommended to them.
Exactly.
Wow.
And now everybody goes online to search for everything, right? And if you go online searching a dentist, if you go to some of the bigger search engines for dental providers, and I won't name names, but you go to this search engine and this search engine, one of the first questions, it's actually the second question on two of the biggest search engines, is do they provide virtual care? So why would you not want to be the yes instead of the no? And then they go looking for the next practice that does provide virtual care. They're in that, 20 to 30-year-old that, like you said, want it on their own terms. One of the comments from COVID that I love the most is practices that provide patient care to the comfort of the patient are going to succeed. If we do it, the way we want to do it, because this is the way we're used to doing it, we're going to get left behind. So if you start looking at how your office is going to open up with technology, we do AI assessments. There's so many opportunities ahead to improve patient care, improve access, get more patients into an office, do higher revenue stream care in chairs, and do the lower unnecessary visits on a virtual visit.
What are the most common misconceptions about teledentistry out there for the public and for dental practices, and how do you address those? Because I imagine there's a lot of people in the public who still don't understand what teledentistry is, but there's also a lot of dental practices who have no idea of the benefit. Mm-hmm. And getting that information to them so they can say, hey, I need to be a part of this, as opposed to I need to be opposed to this. Mm-hmm. How do you go about that? Let's talk about the dentist first and then come back to the public.
Mm-hmm. Well, as a dentist, I know dentists are not the most out of the box thinking professionals that there are. So I remember a long time ago trying to put computers into our office, and one of the dentists said, show me a computer that can help me cut a better prep and I'll buy one. It's like, probably not going to modernize into the computer era. So it's the same thing. We're stepping into a new era of people want care at their fingertips. They want Amazon, they want Uber, they want to be able to access information, talk to the right person, and find out what needs to be done immediately. They don't want to, as you say, one time we apologized to a patient because it was about 12 minutes before we got to the call. And she said, shoot, By the time I'd gotten my keys back down my driveway and driven over to an office, it would have taken a lot longer than that. No worries. So patients want things done. People want things done at their own, in their own terms. They don't want it done in our terms anymore. So this gives people a dentist an opportunity to offer care in the terms that the patients want and still provide the same quality care they do when hands-on care is needed. So that's for the dentists. It's just sort of start thinking outside of the realm. In fact, one of the many courses I'm going to be offering on your education site will be how to implement virtual care into your practice. And it's important to understand how to convert from hands-on, not being able to touch the patient, to this is an interview, and this is where I usually find out all the information to begin with anyway, and be able to talk to the patient and provide the care that they need, and then set them up for the right appointment when they need to come in. People are pain driven, in the United States, and I'm sure Australia is not that much better. 50% of the population does not have a dentist. 50% doesn't have some office to call and say, I need to come in. So they are looking online for what to do for help when they need it. And that's where telehealth comes in, teledentistry comes in. And that's, the consumer's much more open to telehealth than some of the practices. And again, those that aren't open to changing and in using technology for good are going to be the ones that get left behind.
Maria, in medicine, and I know because somebody who I'm married to is very much a do my research, tell the doctor what I think is wrong with me sort of situation. Mm-hmm. Is that an issue in dentistry that sometimes the patient's looking for the answer, it's nothing, you don't have to go to a dental practice, whereas traditionally dentistry is something that people put off until it becomes so bad that they should have gone 6 months earlier.
Mm-hmm. Well, our guideline is, again, in our intake information, it was when was your last dental exam? So our guideline is if it was over a year, we educate our patients, right? The dentist says, and I see it's been a year and a half or 10 years since you've seen a dentist. You need to get in for routine care, x-rays, etc. So, it is education for patients to understand the importance of all that. And it is the professional's job to do that, without a doubt. Like I say, we don't replace dental visits. We educate the patient of the need for dental care, but we are that intermediary care that can be provided when no other care is available. Or in the I keep saying in the United States, David, because you're in the Down Under. I love that. We did a national survey, and shamefully enough, we did it to find out access in practices to patient care. And across the country, people spend thousands of dollars on all these wonderful websites that are supposed to drive patients into the practice. And support and educate patients. And after hours, not one practice had, if you are not a patient of record, here's what you can do for help. The only thing ever said was patients of record, contact this number or to click here and get information. When 50% of the population doesn't have a dentist, there's going to be a lot of people looking at those websites for care that still have nowhere to turn, thanks to our professions being narrow-minded enough to think they only need to treat or be caring for their patients of record.
Yeah, they're punishing people who all of a sudden need a dentist, want a dentist, and now they're being told, go to the back of the line.
Yes.
That's not a really good
luck.
way of running anything.
Find good luck. We don't care. It literally sounds like we don't care. And then sadly on the patients of records, this whole study was done that we followed the steps on what to do if you're a patient of record. And a lot of times it was a voicemail that said, leave a message and we'll get back to you. And then it wouldn't be answered till like the next business day. Or if it was a weekend, it wouldn't be answered till Monday morning. So it's really, we're not providing the kind of coverage we should for our own patients. And we're definitely not providing coverage for the general population in terms of helping people attain dental help.
Yeah, it's a crazy question. Take teledentistry out of it, and you get it just calling an office during business hours. Press 1 if you're an existing patient, press 2 if you're a new patient. But when you press that, nobody ever asks, why are you a new patient? Why are you changing? Is it fear that's kept you away, or
Right.
you've just moved to a new area.
Right.
It's why are you asking that question if you're not doing anything with it?
Mm-hmm.
But in that question of after hours, no treatment at all, no option at all for patients not of record. Imagine going to a restaurant. Have you been here before? No. Go to the back of the line. We only let our regular diners in here.
Right. Right. And so
How
now
do they grow their business?
they have no choice a lot of times in the United States in 2022. And again, the reason we started this, almost $3 billion healthcare dollars was spent in emergency rooms on toothache codes because there was nowhere for these people to go. So they go to the emergency room, which makes no sense, but that's what happens. And there, it's, again, studies show 95% of those people are not medical emergencies. They don't need to be there. They could have had a teledental consultation and been provided that at least intermediary care, education, triage, palliation, if that was available to them, and saved, billions of dollars of healthcare dollars on wasted time in emergency rooms.
I see it as such an opportunity of educating the non-regular patient.
Yes.
To contact Teledentistry and find out what I need to do about this thing that looks weird.
Where do I go? What do I do? Right, exactly.
About the chap who was looking around his mouth and thought a torus was a tumor.
Mm-hmm.
Well, what about if it really was a tumor,
mm-hmm.
and somebody sees something in there and they say, I need to get that checked out straight away. Mm-hmm. Who should I talk to? Because the sad thing about tumors, let's talk about. I remember at dental school they said a farmer had a basal cell carcinoma on the middle of his chest. When it was small, he thought it was too small to worry about. When it got big, he was too embarrassed to do anything about it, and so it was a fatal mistake. By the time that he took it to medical attention, so Teledentistry offers the general public that opportunity of replacing. It's almost like the AI because it helps them find the answer quicker rather than have to work it out themselves by Googling it.
Exactly.
Because they get to talk to a dentist and the dentist will say, you need to see somebody about this.
Exactly.
You need to get yourself to a dental practice, not to a hospital.
Exactly. And then we help them do that. We just don't say, go find a dentist. We help them get that appointment set up in their area, in their network, so that they can actually be seen. And again, patients we have a 95 net promoter score because they love, our consults are just like you and I are doing. They absolutely love talking to a professional on a one-on-one discussion. In an office, somebody's buzzing around behind them, telling them there's a patient in the next room. Someone buzzes in and asks questions, and you never get this one-on-one care that you get on a video consultation because it's always so busy and so hectic in offices. So patients love us. Our post-patient visit, people that did get to us, 84% of them said they avoided going to the emergency room because they got to talk to the teledentist. So we do provide that care. And again, is it a tumor or not? If the patient puts they haven't been to a dentist in over a year, we set them up and encourage them to go to a dentist, to get a dental home, to not use our services. We don't want repeat customers. We want people to get into a home and get taken care of. So if it's been over a year, that person should go in and have that looked at, anyway. But, tori are pretty much of a dead giveaway most of the time. But, had they been a year or 2 or 3 out of the dentist, then you need to go in and be seen anyway. And medical people always ask me how you do teledentistry. And I love my answer to them is, I'll look over at their list of things they do on, if it's in an exhibit. And I said, well, you can do coughs, colds, fevers, urinary tract infections. And I'll say, you say you do UTIs for women, but when they come in and you're doing a UTI, you don't get all up in there to find out if she really has a UTI now, do you? And they go, well, of course not. I said, no, you listen to the woman. She's had this problem before. She knows what medication works. This is the symptoms of UTI, and you get her medicated and get her feeling better. And the closing comment of every telehealth visit is always, if this doesn't get better in 2 weeks, go see your doctor. I mean, even telemedicine knows they don't have hands-on or tests being done, but they know the symptoms. They listen to their patients, and if they don't get better, they need to go see a hands-on doctor. Same thing with teledentistry.
Yeah, yeah, it's really good analogy there with the UTI, because it's inside the body, just like inside the mouth.
Exactly.
It sounds like we can try this, but you need to get yourself to see somebody face to face to check it out exactly. Really, really
Exactly.
good. Are there any regulatory challenges in teledentistry that it's facing at the moment? And how, if there are, how are these being addressed?
Well, it changes every day regulatory wise. I'm working with a group on federal regulations because states are, we have 51, well, in Washington, D.C., so we have 50 states and Washington, D.C., all coming up with their own regulations and terms. And basically, since it's out of business, a Smile Direct Club sort of ruined the word teledentistry by doing inappropriate direct-to-consumer care. So all of these organizations are trying to prevent another Smile Direct Club from coming in and doing direct consumer care. So they are trying to ratchet down teledentistry, and by doing that, they're also therefore decreasing access to patients to get care if they don't have a dentist of record. So we are always working with state boards on a one-on-one 50-state basis to try and help them understand teledentistry is not just orthodontic, direct to consumer ortho, and educate them on what we can provide to patients that aren't patients of record in an intermediary care. So it's regulations change every day, and it changes in 51 different locations, 51 different regulatory agencies. That's why I'm working at the federal level to see if we can get some universal mandate like the Public Health Emergency Act that mandated, different touch points for telehealth during COVID. Still trying to get some of those laws passed with teledentistry included.
So you're fighting City Hall a lot of the time.
Oh, yeah, maybe. Why not, right?
Yeah, it's sometimes the simplest things seem to take the longest time, and also as you pointed out with Smile Direct, one bad example can really delay a lot of things
Yes.
because all of a sudden they want to over
Regulate.
over regulate, yeah, and over protocol
Mm-hmm.
what has to be done.
Mm-hmm.
Too many hoops to jump through, which
Yep.
can be, some people will just give up. In terms of you as the organization, as teledentistry, sometimes things are too hard to get the end result. But congratulations on persevering, because this definitely is something that will help people get to the dentist no matter what they ring for.
Mm-hmm.
We can say, well, this should fix it, but if seeing as it's been so long since you've been to the dentist, you really do need to get yourself a regular dentist, because the mouth's a big place. This is only one little spot. There could be other things in there.
Right.
I've often said to people and patients, it's a shame that dentistry doesn't kill people. It can, but very rarely, because maybe they take it more seriously. But then again, smokers don't take those photos that are sticking on the cigarette pack and say, that's not going to happen to me. So dentistry is a tough sell. It was once told to me that it's a grudge buy. People don't want to do it. They'd rather nobody ever wakes up on a Monday morning and says, I got $500 in my wallet. I think I'll go down and see what I can buy down at the dentist.
Mm-hmm.
It's a grudge buy. Teledentistry is
Except
helping.
whitening. Whitening, even if you have terrible teeth, they want them white, right? See, yes, I've done this for years, obviously.
Yeah, that's right. Yeah. But your breath smells. Yeah, but I just want white teeth.
Yeah, exactly. Or you've got a big cavity there. I don't care. I just want my teeth white. But it is education so important, because oral disease is the most prevalent disease in the world, and we still pay no attention to it on a healthcare basis. I mean, one of our huge mandates for our company is dental medical integration, and to get physicians to be part of the oral healthcare community by embracing an oral exam, setting up with the teledentist, applying fluoride at least to these kids that may see a physician 10 times in their early years, but never a dentist. So they can have fluoride varnish applied, 2 or 3 times during those interim times and actually prevent decay as they got, and training the physician staff to apply silver diamide fluoride if there is decay on kids that, are not ever going to get taken to the dentist. I mean, there are kids that enter kindergarten here with 4 to 5 cavities that have just never been treated, never see a dentist. Still, even in the United States, and then worldwide, globally, it's an epidemic, a silent epidemic globally, because it's the most prevalent disease in the world. And yet, the World Health Organization came out in December of 2022 saying oral health must be part of the Universal Health Care Plan by 2030. So that's the World Health Organization's goal, is to get oral health embraced as part of the Universal Health Care Plan, which means, in my opinion, that all medical insurances in the United States must include dental. It can't be an opt-in or opt-out for dental. And we have a huge, global impact that we need to make by making healthcare include oral health in order to get people healthy.
Yeah, it's crazy that people don't understand that if you've got an infection in your mouth, the body tries to fix that by producing white blood cells in other parts of the body. So you're making the rest of the body fight. They think that the mouth is some separate piece of the body that doesn't affect. It's really like the mind. You can't have an evil thought in your mind and then say I'm a good person. It creeps across, and in here, whatever's going on in here affects everything else.
Right. Inflammatory responses, even gingivitis stimulates inflammation, which goes systemic from the mouth very easily. And again, here, healthcare, diabetics, you cannot improve your A1Cs or lower your blood sugar with chronic infection in your mouth. It just is impossible to do. But physicians will increase your medication dose without ever asking you if you've been to the dentist. I mean, that's just such a huge problem. And that's such a it's not even correlated. That's so been proven. You have infection, you have inflammation, your blood sugar is going to go up. And on one of my presentations, which I will be again doing with your group, I show an arm, that has a 9-inch cut up the arm, this giant gaping wound on the arm. And I said, if this wound presented in a medical office or a hospital, there would be all hands on deck to clean it, debride it, suture it, fix it, make sure it healed. And 74% of people over 65 have periodontal disease that have, from here to here, top and bottom, inside and out, it's about 9 inches of gingiva laying against the teeth. And if that 9-inch wound is ignored, literally ignored, there's not all hands on deck to make sure you even ask about it. You see if anything's being done about it, or are you assured that this wound is going to heal up? Nothing.
Yeah, it's crazy. The other effect, Maria, and I guess this is we're getting a way to encouraging people to visit the dentist is that just the numbers. If you've got 4 top molars and 4 bottom molars, that's 16 molars. But every time you lose one, the opposite one becomes useless. So you really got 4 pairs. So every time you lose one molar, that's a quarter of your chewing capacity gone. So you either got to chew your food for longer, or you got to cut it into small pieces. Otherwise, you're swallowing it in bigger pieces. Guess what? All those glands down there in your body have got to secrete more to try and dissolve that meat. That's not happening. Has anyone done surveys on the relationship between missing molars and incidence of bowel cancer and diverticulitis?
I'll have to look at that. That's not anything I've ever looked at before. But what is staggering is the research that is out there that is, bullet point on what needs to be done is ignored. Here it says it takes 17 years for research that will impact someone's well-being to get to the consumer. After the research is, but there's research that's out there far longer than that. that would actually, show that improvement. And again, that's what we do is screen and prevention. Again, prevention is we do AI screenings that are basically there's a problem here or no, you look fine, let's do fluoride varnish. And we train the staff on how to do fluoride varnish. We train school staff on how to do that if there's no problem, and train them on how to where to refer and how to refer if someone has a problem, or in the intermediary step of doing some silver diamine fluoride on simple problems to prevention, and get people to that state where they don't have 4 or 5 cavities when they enter kindergarten. And then that population will not show up in the emergency room as much. So by being able to provide access to teledentistry anywhere there's pretty much cell phone access, but definitely internet access, and to be able to speak, you have a oral healthcare professional training staff, educating people, and being able to get the products to them that can provide the care in any community, and outreach is a way of getting, expanding access to oral health care using teledentistry. And any office can do that by having an outreach to their community as well by doing teledentistry.
You read my mind because I was just thinking, what's the impact teledentistry is having on people in remote communities where it's difficult to find a dentist during the day, let alone after hours. Teledentistry is obviously having a big impact there.
It can when rural health is huge here, and we're still trying to get break down the barriers to say oral health has got to be included in this. We're making huge inroads into senior care facilities where oral health is largely ignored, and being able to get into senior care places and help the seniors attain and maintain good oral health is a great aspect that we're doing. And then school systems, if we can start with Head Start, start when they're 4. If we can start with Head Start where you actually go into the home and they have younger siblings, this is where it needs to start, is being able, again, to have a dentist wherever a dentist is needed, in the home, in the school, in the senior living spaces, and in rural health. And you can do that virtually.
How much of the teledentistry is done with the camera as a video?
Intraoral cameras or?
Oh no, just phone to phone. Do you get people to say, "Show me it on the phone," or is it?
No. 95% of our patients come to us on the cell phone. 95%, and they're talking to us, and they're like, they're sticking their phone in their mouth and just leave it she's back here. So we have that's basically all of our patients. And when we go into senior living, the staff will have their cell phones to be able to take pictures, and the AIs on the cell phone, they can do the assessments with AIs on cell phones. So this is the greatest healthcare tool that's ever been invented.
Fantastic. And now the latest cell phones have also got a macro button so that you can do in close up in focus as well. That's excellent.
Absolutely.
Any good success stories that you can share in terms of somebody's rung up and you've saved their life, or helped them with
Well, yes. Okay, my favorite story. I had to take a pause because I do these presentations all the time. My favorite story was a review we got from a mom who said, "I am a single mom with 2 disabled children." And she said at 2:00 in the morning, I thought I was going to have to get them out of bed, dressed, and go to the emergency room until I found the teledentist. And they got, said, "You guys got a 24-hour pharmacy," and I was able to get my pain under control, and I didn't have to get, sit in the emergency room with my children for all that time. She said, "Thank you. You're a godsend." So, I mean, that's one person responding at the impact it had for her. And that's my favorite review we've ever had. Yeah. And that kind of thing really gets to you.
Well, yeah, who's she going to ring? She's going to ring her mother and say, "Can you come and mind the kids? I've got to go to
2 in the morning." Right.
Yeah, not going to happen. That's and sometimes I think dentists don't realise that there's a need there for that sort of relief of pain. We all know as dentists that patients in pain will tell you it's the worst pain they've ever had in their whole body is a pain in the mouth. So it's yeah. Sometimes I tell dentists this too. Sometimes we get so conditioned to what we do, we don't realize that going to the dentist, finding out about dentistry is really a big dark grey area, black hole.
Hmm.
It's annoying for a lot of people. It's scary,
Hmm.
and we just get so naive. Ah, it's only a needle, quick, it'll be over.
And that
And
reminds me of another story from a different healthcare professional. When we now do AI second opinions for X-rays, we'll submit them to an AI processor, which the computer will kick out what they see on the X-rays, and then the dentist talks with the patient about what the X-rays show, et cetera. And another healthcare profession said, this is incredible, almost the exact words you said, because going to the dentist and having an x-ray is like being in a dark hole. You don't know what they're telling you. You don't really know what's on there. You just depend on them to tell you that all this is this and this is this and this is this. But doing it by AI, you have a machine telling you absolute facts on what exists and laying it out for you, pointing it out, little squares of where the cavities are, marks where the periodontal disease is. And he said, this is a great asset to be able to have, get out of the dark hole of dentistry. And those are the words he used as well.
yeah, I see AI in helping to standardize diagnosis,
Mm-hmm.
really important. But for the time conscious people, and also the
Mm-hmm.
location deprived people,
Mm-hmm.
teledentistry is a real asset
Mm-hmm.
in helping them work out a plan and then move back to
Mm-hmm.
hands-on dentistry to get their solution to their health.
Well, what someone in Montana said, and this is exactly what teledentistry can do. She has to drive 90 miles to get to a dentist office. And she said, I can drive in and sit down. And they'll say, you need to come back in 2 weeks to have this done. So that just has eliminated 180 miles that she needs because she can talk to the dentist from home. They can determine what she needs to have done when she comes in, make the appointment time for that 90. She still has to drive 90 miles to the dentist, but not a wasted trip. And that's the kind of thing that, you may still be 90 miles from a dentist, but when you go in, you know what you're going to need. They have the time set aside for you and everything's ready to, be taken care of when you're there.
Yeah. Um, Maria, teledentistry is not going away. It's just going to keep getting more and more accessible and more useful
Mm-hmm.
for dental practices and for patients.
Mm-hmm.
And as we've discussed, hopefully it'll also expedite the integration with medical,
Mm-hmm.
as
Mm-hmm.
opposed to the compartmentalized, which has gone on.
Yes.
Oh, it's just a tooth, you know.
Yep.
You've got plenty. So
Yep.
I think teledentistry. Thanks for spending time with us today and unpacking the benefits of teledentistry for the public, the
Mm-hmm.
benefits for um, the providers of health,
Mm-hmm.
because it dental problems, wasting time in emergency rooms, and also for dental practices that can use that as a triage
Mm-hmm.
to shorten nobody wants that, like that story you just said, drive 90 miles either
Yeah.
way
Yeah.
to just have this is what you need, come back.
Mm-hmm.
Nobody wants that.
Mm-hmm.
Maria, thank you for taking the time for being on the Ultimate Dental podcast.
Mm-hmm.
How can people get in touch with you
Mm-hmm.
um, at Teledentistry? What's your email? What's your website? What's the best way to get in touch
Yeah.
with you?
The website is the teledentists plural.com. And my website is Maria K, as in my last name, at the teledentist.com. So please contact me. Again, I'm really excited to be able to offer a lot of this in more detail at the Academy and be able to give some courses in how to integrate, a virtual care into your practice and dental medical integration and, basically how to walk the walk and talk the talk as a teledentist, how to be a teledentist. So we have a lot of course opportunities available coming up as well.
Oh, excellent. Yeah, we're looking forward to having those courses on the Advance Me
Mm-hmm.
platform. So
Mm-hmm.
thank you very much for being a part there. And I'll put the link for that on the podcast notes
Mm-hmm.
when people watch this back at the end for those who are watching back the replay. So, Maria Kunstadter, thank you very much for spending some time with me, evening time, your time, lunchtime for me the next day. It's been great talking with you on the Ultimate Dental Podcast. Thank you very much for being a guest.
Thanks for having me, David.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.